Good morning everyone. I am Dr. Nikhil from Sarojini Devi Eye Hospital and I will be presenting on the topic Eye on the clock using vitreous humor electrolytes to determine the time of death. As we all know, the number of unnatural deaths is increasing nowadays. So it is becoming more and more important to find the specific time of death. One such substance used to determine the time of death is the vitreous humor. It has electrolytes such as potassium, sodium and chloride, whose concentration estimation can lead us in determining accurately the post-mortem interval. In this case control study, we involved a total of 80 patients of age groups 5 to 83 years. Cases were the patients with unknown time of death brought from outside the hospital, and controls were patients with known time of death who had died inside the hospital. Vitreous humor of both the eyes was collected with the help of a 10 ml syringe and placed in two separate bottles. The samples with turbidity, blood stains, and patients with cases with unknown electrolyte profile were discarded. On analysis, it was observed that the vitreous potassium levels had a significant association with the time of death, with potassium levels rising as the post-mortem interval increased. It was observed that 1 milliequivalent rise of potassium in the right eye led to a PMI increase of 0.6 hours, and a 1 milliequivalent rise of potassium in the left eye led to a post-mortem interval increase of 0.7 hours. Sodium and chloride also did have a drop in their levels, but this was not at all significant. This is the graphical and tabular analysis of the right and left electrolytes of the both eyes. So, after comparing with other studies, in a study by Jaffe, it was found that potassium had a positive correlation with the time of death. The results of the study conducted by Balasurya et al., where there was a slight negative correlation between vitreous sodium concentration and PMI, was observed. In a study by Vincent, electrolyte changes are reported to be in proportion with the post-mortem interval. In our current study, there was a significant linear relationship between potassium levels and post-mortem interval, with no significant correlation between sodium and chloride levels with respect to the time of death. As all studies are there were limitations in this as well. There were very less number of cases involved in our study. Many cases which came from outside did not have a serum electrolyte profile antemortem, and prolonged studies should have been carried out in which a larger population could be screened and in different kind of environments and seasonal variations. So to conclude, there is a relationship between vitreous potassium concentration and time since death, the relationship being linear increase in the potassium concentration after death. At last, I would like to thank the ICMR for helping me with this project. Thank you.
Nice presentation, almost taking you back to forensic medicine classes. How would you actually assess if that person who died had some kidney function disease, kidney disease, and his potassium was raised from before or was low from before?
Exactly.
You're just making an assumption.
Few cases which we had known, they had some brought from outside for post-mortem, and we knew about their electrolyte profile or diseases. We directly excluded their samples. But the other cases we couldn't exclude. That was a limitation for our study.
So what is the clinical implication of this study that you want to know the time of death?
Yeah.
So where it is very important for you to know what is the time of death in patients?
All medical legal
Murder cases.
Medical
like
legal and others?
Medical.
Others?
It has multiple uses.
Multiple, that is what I am asking you. There are multiple, besides medical legal, for our ophthalmologist is...
No idea.
Okay.
So you approached for this study or ICMR approached to you for this study?
No, I approached ICMR. They have that stored studentship.
So how did you conceive the idea that after getting the vitreous sample for potassium
Actually,
on a head?
He's asking a Sherlock Holmes question. Why death and timing and all came to your mind? Go ahead.
I did this when I was a second year undergraduate itself. And my father is a biochemistry teacher.
Okay.
So while reading forensic one day, we had read all the fluids can be assessed to determine the time of death. So we had a discussion and we thought it could be a good study to be done.
Brilliant thought.